Hello, everybody. Welcome to the News at 5. I'm Rick Chambers. Courtney has this night off. President Biden back in isolation again after testing positive for COVID-19. But unlike last week, he apparently has no symptoms this time around. The president's doctor says the rebound infection caused by those antiviral pills that the president was taking after he first got the virus. Let's go right to John Fanolio. He joins us live from the News Center with more on this. John?
Hey, Rick. Well, the White House may have been surprised by the president's diagnosis, but they were prepared for it. President Biden has been testing negative since Tuesday. That is, of course, until this morning. Now, his doctor says he's currently feeling well and is not experiencing any COVID symptoms.
Hey, folks. Joe Biden here. Tested positive this morning. Going to be working from home for the next couple of days. And I'm feeling fine. Everything's good. But Command and I got a little work to do.
President Biden again testing positive for the coronavirus late Saturday morning. The announcement comes just days after the president was cleared from COVID isolation and returned to the Oval Office Wednesday. He first tested positive on July 21st. The White House describing his diagnosis as a rare case of rebound following treatment with the antiviral drug Paxlovid.
A small percentage of people who take Paxlovid rebound, and it's very short-lived.
Dr. Suman Radhakrishna is the director of infectious diseases at Dignity Health California Hospital.
This drug reduces symptoms. It keeps people out of the hospital. It also enhances their becoming negative sooner so that their risk of giving infections to other individuals is a lot less.
Paxlovid is authorized for emergency use and must be taken early on during infection to prevent severe illness and hospitalization. It's prescribed for high-risk individuals and people over 65. The medication is taken orally twice a day for 5 days. The president's physician releasing a statement saying, in part, "The president has experienced no reemergence of symptoms and continues to feel quite well. This being the case, there is no reason to reinitiate treatment at this time, but we will obviously continue close observation." Pfizer, the company that makes Paxlovid, says clinical studies suggested that about 1 to 2% of people treated with the medication tested positive again. But a number of other experts put that number at about 5%. Noting the drug appears to remain effective at preventing severe disease.
Do you think that we're seeing more rebound cases because Paxlovid was tested in clinical trials before Omicron became the predominant strain of the virus?
If we had the luxury of time, then we could have tested it for a longer period of time, and perhaps we would have seen all of these. But we don't have that luxury, and people who are at high risk of getting worse and falling sick and having serious COVID is still existent.
Now, per CDC guidelines, the president will isolate for at least 5 days until he tests negative. And like the last time, the White House says he will continue to work virtually. Advisors say he will no longer make planned trips next week to his home in Delaware and a visit to Michigan. Rick, I'll send it back to you.
All right, John, thanks for that.